today's episode, we'll be treating on a very important topic that, though very common, but a lot of persons don't know some important details about it. Today's topic will be treating on pile, which is commonly called hemorrhoid in medical terms. Pile is a disease condition that I know most of us have heard about, which is very common. The question is, what is pile? Pile is a situation where there are swollen veins in the anus or in the lower rectum, and it is akin to what we call varicose vein. That is, veins that are dilated. I know most of us have heard about varicose vein. And one thing about pile is that most persons do have pile, but it really doesn't cause any symptom. Hence, they can live their life and wouldn't know that they have pile. In some situations, it can cause some symptoms, which is the reason why we are talking about it today. The next question is, what are the symptoms of pile? And basically, talking about the symptoms of pile depends on the type of pile. And we have the internal pile, which is pile that is located inside the rectum, the lower rectum. And basically, internal pile causes mostly painless bleeding after stooling. The person notices that after using the toilet, you notice that there are blood on the physics, and usually the bleeding is usually painless. And the second type of pile is the external pile, which is actually pile that is located around the anus, and it usually causes irritation, itching. The person may notice pain after defecating or even during defecating, and also bleeding. The person also notice that there is bleeding after defecating. The external pile is usually found under the skin of the anus, and most times it can cause itching, it can cause irritation. The person will also notice that he or she is bleeding after defecating, and it usually causes pain. The next one is thrombosed pile, and in this case, blood can actually pool when someone has an external pile, and because of that pooling of blood, it can cause blood clots, and as a result, cause swelling, can cause inflammation, and it also results in pain after defecating, in addition to bleeding. And after that, we have the prolapsed pile. This is when either an internal or external pile stretches or bulges outside the anus. Then the next thing we're going to talk about is the risk factors or what causes pile, because it's very important for us to understand what increases one's risk of coming down with pile. The next is, what are the causes or risk factors to pile? And basically, pile results in when there is an increased pressure in the lower rectum, and this can occur when one is training, doing oral habits. Then secondly, it can also result in when one spends a lot of time during going to toilets. That is when one is sitting for a long period of time in the toilet. It can also be as a result of when there is chronic constipation or diarrhea. One is having diarrhea or constipation for a long period of time. Then next is being obese is a risk factor to pile. Then also for individuals that have anal sex, they are predisposed to having pile. Next is when one is eating diets that are low in fiber. And another thing is during heavy weight lifting, individuals that lift heavy weights. Okay, also pie can be as a result of being pregnant, having chronic cough, or as a result of increase in age. So these are the things that increases one's risk to having pie. And most times when an individual have pie, you discover that one or two of these risk factors are found in that individual. The next is, what are the complications of pile? What are the things that one having pile can result in? First of all, it can lead to anemia, that is low blood level in that individual. It can also lead to infection. That particular area can get infected. Pile can also lead in clots. That is one having blood clot around that area. That's what we referred earlier as thrombosed pile. It can also lead to one having skin tag, and it can also lead to it being strangulated. That is the thrombosed pile that we talked about. Before I talk about the treatment of pile, I would want to mention that there are other conditions that can have symptoms that are similar to pile. That is symptoms like bleeding, like pain during defecating, and most times some of those conditions can be life-threatening. And that is why it's very important that when you're having bleeding, when you're having pain while defecating, that you go see a health professional for proper examination. There are conditions like one having colon cancer, one having disease that in medical parlance we call inflammatory bowel disease like Crohn's disease, ulcerative colitis. These are conditions that can cause symptoms that are similar to pile, and it's very important that when you have pain while defecating, when you have bleeding, that you go see a medical practitioner so that you'll be properly examined. Coming to the treatment of pile, I would want to say that in most cases, the symptoms of pile go away. That is, the individual will notice that the symptoms are no longer there. But basically, to treat pile, first of all, we encourage them or individuals to drink a lot of water. It's important that the person takes lots of water. Then also eating a meal that are rich in fruits, vegetables, and high fiber diets, which will help to make the stool consistency to be soft. That thing is very important is sit bath. That is what we call sit bath. That is sitting on warm, salty water for some time. It helps to shrink the vessels around the anal region, thereby reducing the symptoms of pile. Another thing is taking pain medication. That is some of these drugs that reduces pain, especially for individuals that are having pile that is associated with pain. Then the next is using what we call stool softeners. These are drugs that help to soften stool. That is usually used for individuals that have chronic constipation. You give them stool stuff softener so that their stool will be softened. The next is using a soft toilet paper after going to toilet as against the hard one that some persons use. I would also want to say that in some cases when some of these measures did not help, the person gets to the hospital, the doctor assesses it and either decides to use a cream or a drug insert, a drug that is inserted through the anus, or in some extreme cases, it can result in the person having surgery to remove the pile. Then let's talk about how pile can be prevented. I would want to say that having pile, the chances of having pile increases as one gets older. And these are the steps that one can do to prevent coming down with pile. First of all, don't sit for long period of time in toilets. Most individuals, when you go to toilet, this is not a time to go with your phone. You are trying to chat, you are trying to do one or two things. As much as possible, reduce the time that you spend in toilets. Secondly, make sure you drink lots of water. It's recommended that every adult should take at least 6 to 8 glasses of water every day. The next is making sure that you eat fruits that are rich in fruits, vegetables, and high fiber diets. Then the next is being physically active. That's exercising, making sure that you have regular exercise. Then finally, use enema or laxative as recommended. Don't abuse it. A lot of individuals they abuse enema, they abuse laxative. That's drugs that are used to soften stool or enhance individuals that are having chronic constipation. Don't abuse it. Use it as recommended. Thank you very much. I do hope that you've learned something today. Don't forget to like, share, subscribe, turn on your notification buttons as we do have lots of very important health related topics for you. Thank you very much. See you next time.